This is SG2 Perspectives, a conversation with SG2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery. We're always looking for new ideas and topics from our listeners, so please reach out, share your ideas. You can email us at sg2perspectives@sg2.com or connect with us on LinkedIn or Twitter, and you can find links to all that in the show notes. Now, on to this week's episode.
The Biden administration is really seeking to reset some of the approaches on Medicaid that they were originally taking under the Obama administration.
Welcome to SG2 Perspectives. I'm your host, Trevor Durin, and although the Biden administration is only a couple weeks old, it seems like we're already overdue for this conversation about how they're going to try to execute on the most obvious healthcare priority, which is fighting COVID, and then how they plan to tackle the rest of their really ambitious healthcare agenda. Steve Rixen from Vizient's Government Relations and Public Policy team is going to join me to give us the insider's view on the what, the how, and some of the speculation about when any of this may happen. Steve, thanks so much for joining us.
Trevor, thanks for having me back. I feel like I'm sort of being called on the carpet for the predictions I made late last year. And so I'm always happy to connect with my SG2 colleagues and talk about all of the madness that's happening in DC.
We rely on you for it, and we always look forward to it. Can you give us a quick rundown of what's already happened since the Biden administration took over?
Yeah, sure. A lot of people like me who work in and around Washington, D.C. policy circles, when Joe Biden was elected, I think we kind of expected there to be the backing off of just the fire hose of policy and news that has been happening. So far, that has not been the case at all. The Biden administration's number one priority is addressing COVID-19. Right now, we're seeing that play out from a legislative standpoint in Congress, where the Senate did just act and approved a budget resolution that's going to set up the process to allow Congress to move forward with the number one priority, and that's pass that $1.9 trillion American Rescue Plan that President Biden has been pushing both on the campaign trail, in the transition, and now as the president. They're moving through the process that's known as budget reconciliation. I should say there's still ongoing bipartisan negotiations taking place to try and find some way to get a deal on this, but simultaneously, there are Democrats that now control both the House and the Senate are moving budget reconciliation that can avoid using the filibuster in the Senate and get this done on a pure majority vote. Now, that comes with complications, to be sure, where there's a lot that's in this package, such as moving to a $15 minimum wage, that may or may not be allowed to move under that reconciliation process. I'm hearing different debates. But in the Senate, all of those different provisions are going to have to run through what's called the bird bath to examine whether or not they're related to spending, raising revenue, or government debt, which is what has to be included in the budget reconciliation process. When these provisions roll through that process, we don't know what's going to come out the other side and whether this package is going to look more like Swiss cheese of that $1.9 trillion original proposal that they're trying to get done, or if it's going to be the full picture. At Vizient, we've actually been working with our industry partners in Washington and advocating for some hospital priorities that we'd like to see included in this reconciliation package. Things like extending sequestration relief beyond where it currently ends on April 1st, or offering new flexibilities for workforce to work in practice across state lines. When you look at provisions like that, it's very unclear whether or not they may fit underneath the confines of the reconciliation process. I've already said a mouthful on what's happening in Congress, but we're just scratching the surface of what's happening in the administration. You've seen Joe Biden has been signing about an executive order or two every single day since he took office on January 20th. So far, we have, I believe, 28 executive orders. Of those executive orders, about half or more of those have been dedicated to COVID-19. Things like requiring masks on federal property, in federal buildings, in federal lands, things like that. Now, beyond that, they've actually done some fairly significant healthcare policies through the executive orders as well. The Biden administration is really seeking to reset some of the approaches on Medicaid that they were originally taking under the Obama administration. Things like preventing states from moving forward with work requirements, as well as making some changes around the marketplace. They're calling for the incoming administration to make changes that the Trump administration has allowed related to less comprehensive but less costly health insurance plans, things like short-term duration plans and association health plans. And the only other thing I'll mention on this front is when the administration took office, they also also did issue the pretty customary regulatory freeze, where that directs the federal agencies to push a big pause on everything that the Trump administration had been trying to push out the door before they left. Under this regulatory freeze, rules that had been to the Federal Register but not published, rules that had been published but did not have an effective date that happened, or rules that were just working through the process have all been paused while the Biden administration is taking a hard look at whether they comply with the law, whether they meet the policy expectations that the Biden administration wants to move forward with. This is pretty customary, but it will have fairly significant impact because the Trump administration really pushed forward with some major regulations right at the close of their administration. Things like the final rebate rule that affected what pharmacy benefit managers could do under Medicare Part D. Things like the Stark and anti-kickback modifications that were finalized right at the end of the year last year. It's not clear the Biden administration is going to stop them from moving forward, but they are definitely going to have a good review of them and potentially be modified through the regulatory process with a little bit more of a Biden fingerprint on them.
That's helpful. Give us a little inside baseball here. An executive order is not a law. What is it? What can it do? What can't it do?
It's not a law. They're essentially just a statement of what the administration's policy is and will be. It can be fairly significant. As we've seen in the January 28th executive order, for instance, the Biden administration did announce they were launching a special enrollment period for people in the ACA marketplaces, which is a huge change of policy. But they can also serve as more of a press release to just say, okay, this is what we're going to do going forward as the regulations are implemented.
One of those things that's unclear to me, if it's really doing something or if it's a press release, is around vaccine rollout. What can the Biden administration and the federal government really do here? Don't get me wrong. I love the idea of just giving states and both the local agencies and the people in that state more visibility into vaccine delivery timing. But how much can the Biden administration really do? What's sizzle and what's steak?
That's a really great analogy, sizzle versus steak in this case.
Because steak is good.
Steak is delicious. No disrespect to vegans in the room or anything like that. I'm very happy with this analogy. But when I look at what the Biden administration is doing with respect to vaccine distribution and getting this information out to the states, I think it's a little bit like a fajita, but not like a full steak fajita. It's like a half and half where you get half steak, half chicken, but you get a lot of sizzle. There's a lot of noise around what's happening, but there really is some substance behind some of the changes that they're making. Reportedly, we're seeing more vaccines being released to the states, which is obviously a promising thing when that's really been the biggest holdup in this whole process. There's further questions about that still need to be answered, but more vaccine is getting out there. They did unveil a national strategy that provides kind of clear framework for what the Biden administration wants to do. Supposedly they're getting more data and visibility to the states in terms of the availability of vaccine, when they're going to get these shipments and orders, which is something that's so badly needed to help sort of fill in some of these questions about when am I going to get the vaccine? How can I possibly schedule patients if I have no idea what my supply is going to look like? And then on top of that, we're seeing more focus on developing that supply. There's been talk about using the Defense Production Act to ramp up how much vaccine can actually be produced. Those are still preliminary in talks with several big other manufacturers, aside from the Pfizer, Moderna, and J&J products that are kind of moving in the marketplace, to try and see if they can ramp that up and just produce more volume. There is some substance to all of that, but at the same time, they're still facing those very real vaccine limitations. They still don't know the full picture of that supply chain. And so there's a lot of confusion across the country as to when that's going to arise or when they're going to get their products. There's also questions about equity in terms of vaccine distribution, which has been a new focus of the Biden administration and something they're looking at. But frankly, they don't have a magic wand. They're still facing a lot of the same supply challenges and other difficulties that the Trump administration was facing in this process. And they're working through it, but it's not perfect at this point. While we have that partial fajita, as more vaccines come online, and I mentioned the J&J or Janssen pharmaceutical vaccine, we're going to get that second helping of those all-you-can-eat steak fajitas, and we're going to have a lot of steak and a lot of sizzle, hopefully in the near term.
That's promising. That's good. Let's move to kind of the next 3, 6, 9 months down the road. At some point, some of our focus is going to shift away from immediate pandemic relief, and some of the other legislative and regulatory priorities of the Biden administration are going to start to kind of take over the national conversation. I'm going to put those in kind of 3 buckets. One is continuing to build on some of the changes we saw the healthcare industry, the Trump administration started. You mentioned a few of them before, like Stark and transparency and 340B and site neutrality. Then there's the ACA tune-up. Obviously, there's a Supreme Court case that could change the trajectory of that. But I want to hear how they could actually do any ACA tune-up. And then the biggest piece is most Democratic campaigns talked a lot about big changes to Medicare and big changes to coverage, but that's all now happening under the new world of what the future is going to look like, which is a lot of budget austerity. The Medicare trust is still on a very quickly ticking clock. Can you talk about each of those three things a little bit and tell me if there's other pieces that's probably going to define the next 3 to 9 months?
I like the bucket approach here because there are very distinct possibilities in each one of those buckets. I will take that third bucket first and talk about what the future looks like in that third bucket in terms of austerity politics and some of the broader reforms that the administration was really looking to take on, some of the Democrats in Congress, such as Medicare for All, things like that. The bottom line in the third bucket is with the narrow margins in the House and the Senate, 50-50 in the Senate plus the tie-breaking vote, as well as a very tight margin in the House, they're just not going to get any of these huge picture items done in terms of Medicare for all or a public option. There is the slight possibility of using another reconciliation vehicle later this year, but that seems very unlikely, especially given the political controversies around those things. There may be some room for conversations around austerity. We know the Medicare Trust Fund is quickly being exhausted, and the spending has certainly ramped up in response to the COVID-19 pandemic. There may be an appetite and interest in doing that, but the political obstacles are still going to exist in that front too. And I don't think Democrats, after watching how Republicans, when they were in control and passed tax relief, things like that without paying for them, there's going to be a big desire for them to really put the brakes on their own ability to spend. It's unlikely in that third bucket that you're going to see many significant changes, either on the austerity front or on the broad pushes to expand Medicaid or Medicare or things like that.
Hard to disagree with that.
Going to that second bucket of the ACA tune-up, all of that is very much going to be contingent on what the Supreme Court does. All signs point to the Supreme Court either dismissing or issuing a very narrow ruling in terms of the legal challenge that seeks to throw out the entirety of the Affordable Care Act. It's wise never to read too much into a Supreme Court oral argument because they can go any number of different ways. So because of that, there's kind of a holding pattern right now to see what happens. If they do have a broad ruling, I think Congress will have to react and figure out a way to reassemble the plumbing of the healthcare system if they yank it all out through an adverse Supreme Court ruling. On the other hand, they could just act now and say, you know what, we're going to get rid of the individual mandate altogether. We don't need it. It would moot the case in the Supreme Court. So that's an option that they may actually feasibly consider, but it's just not necessarily something that's a priority for them to act. I think both sides wouldn't mind having the political fight around the ACA. So it all really kind of comes down to the Supreme Court. Whether or not they issue that negative ruling, then all bets are off in terms of both that second bucket and the third bucket, because you have to go back into the entire fight around the ACA coverage reform in general. In terms of the first bucket, one area where there is not political controversy is around some of the efforts that the Trump administration pushed through the Centers for Medicare and Medicaid Innovation that would do things like direct contracting or the geographic contracting model. Those are not necessarily areas where there's any partisanship or any real concerns about that move toward value-based arrangements. There's an interest, but we saw even with the Trump administration, there was a carryover in many ways of a lot of the policies that the Obama administration had pushed forward, and there's no real reason to expect that to change. There could be some new former Obama legacy CMMI folks coming back into the mix. And so long story short, in terms of moving forward in the more impactful Medicare practice changes and delivery system reforms, we really don't expect there to be a lot of change. You know, one other of the Trump administration policies that really has raised a lot of questions is whether or not some of these adverse 340B policies are going to continue. Things like cutting reimbursement for drugs purchased through 340B. That's been the main focus area of a lot of hospitals over the last couple of years and something that's been adopted through the regulatory process. It's still going to have to go through the regulatory process again. So it's an area we're watching. Not only that, because the 340B program is budget neutral, they have to figure out how to reallocate that funding across the entire spectrum of hospitals that are getting those cuts applied to them. That's an area that's something that we're going to keep watching for in the IPPS and OPPS rules coming up later this year, something that could definitely roll back that approach on the 340B drug pricing program.
Site neutrality probably will continue. Transparency initiatives probably will continue.
Absolutely. What we've been hearing is that there may be some more grace in terms of responding to the immediate financial hits from the COVID-19 pandemic. But by and large, we do believe that the policies around price transparency and around site neutrality really transcend both administrations. There's not a lot of desire to all of a sudden get rid of all these price transparency regulations and just move back to the way it was. This is a process where I do think that they want to move forward in the same way that the Trump administration has, though you may see some temporary relief from a hospital perspective.
What about COBRA subsidies? Did that make it into the current relief package that's being negotiated? It's more likely in this administration than the previous administration, but I haven't heard if it's going to be kind of a standalone or if it's going to be part of a relief package or if it's something that is on the table for the summer. What have you heard?
Right now, in terms of COBRA subsidies, the administration is definitely interested in moving something in that direction. There's legislation in Congress that would provide for that, but it is a heavier lift than some of the other policy changes. So it's not clear whether they're going to be able to attach them. And then on top of that, when you look at perhaps the reconciliation constraints that these legislative packages are going to have to go through individually, that's one of those areas that could be struck in the reconciliation process. If it does move, it would have to move probably separate and apart from this main legislative vehicle. I don't want to completely discount the possibility, but it's a lot more difficult to move forward with something like that than it would be if it could attach in a massive bipartisan legislative package.
What's something I didn't ask about that you've been hearing that could be a bigger priority than we're expecting, either next week or down the road later this year?
One thing that I've really been keeping my eye on is this cottage industry of press reporting that really tries to target hospital billing and collections practices. Now, we just saw this last week, there was a really difficult story in the New York Times that Sarah Cliff published about using liens in terms of recovering reimbursement from insured patients and trying to go after in car accidents, trying to go after any settlements that they may receive for the full amount. Now, it's a really tricky story, and we understand hospital practices vary across the board, but when you see stories like that, they start to get attention in Congress. I see there could potentially be some interest in Washington around doing something around billing and collections actions in hospitals. It's not necessarily something they're all dying to move on because the hospital in their district is not one of these bad actors, but a good actor, for instance. The obvious one that I probably should have talked about much earlier in this process is drug pricing. There is still an interest in moving a comprehensive drug pricing piece of legislation. Elizabeth Warren just moved to the Senate Finance Committee. She made this her number one priority. But there's actually an interesting option for bipartisan approaches to drug pricing. The new incoming chair of the Senate Finance Committee, Ron Wyden, was a chief sponsor of a bill that really got close in the last Congress to being passed. And that was a piece of legislation that would require drug makers to provide rebates if the price of their drug grows faster than the rate of inflation. Fairly significant piece of legislation, but it did have really strong bipartisan support. And the only thing that stopped it from moving to the floor in the Senate was then Senate Majority Leader Mitch McConnell, who said, you know what? We've got Republican support for this, but we don't want this to move forward just yet. The House has a more aggressive bill that was out there. Not likely that the House bill could possibly get across the Senate, but we just don't know. There's a lot of different options that could come to play in the Senate in negotiating around this. So that's one area where I think if you put a pin later this year before the August recess, that could definitely be on the agenda.
With Xavier Becerra coming as the new HHS secretary, coming from California, Sutter was under a lot of regulatory scrutiny. Do we think he's going to bring that same level of scrutiny to HHS? And at the same time, I know it's not under his umbrella, but do we expect FTC to look more closely at some of these? There's probably going to be big, either healthcare vertical or horizontal mergers in the next couple of years.
There's definitely an interest, though I guess I would split this a little bit because it's interesting you mentioned Xavier Becerra coming in as potentially the HHS secretary, an area where he's frankly not going to have any control over what the FTC does. Although in California, he certainly had a huge interest in pursuing some of that effort. The new FTC, new leadership at DOJ coming in could definitely be taking a harder look at this, but it's generally going to be reviewed on a case-by-case basis. There was legislation introduced just this week, I believe, by Senator Amy Klobuchar, former presidential candidate, that would push for a new standard in terms of how they review a lot of these mergers and acquisitions, not necessarily specific to hospitals, but there's definitely bubbling interest in this subject and something that we could see really rise to the surface throughout the year. It's going to be tricky.
Steve, thanks so much for sharing a lot of different things in a lot of different directions and speculating about something that's very hard to speculate about with any certainty. I always really value your insight and perspective. So thanks for joining and sharing it with our listeners.
Thanks for having me.
This has been another episode of SG2 Perspectives. If you like what you are hearing, please subscribe and don't forget to rate and review. We'd love to hear from you. Please connect with us on LinkedIn or Twitter at SG2 Healthcare. You can also reach us via email at sg2perspectives@sg2.com. Reach out and let us know what healthcare trends are most important to you. Please also listen and subscribe to our colleague, Dr. Tom Villanueva's Modern Practice podcast on Vizient's Medical Leadership channel. Tom discusses key healthcare trends through the clinical leadership lens. You can find it wherever you listen to podcasts. Thank you for listening.